Have you ever had a dental cavity, or any of your loved ones or friends has had a dental cavity, a dental decay, or for that matter of sake a root canal treatment? Hi there, welcome you back to the Edentofacia channel. Today we are going to discuss everything about dental cavities, how it is formed, how we can avoid having them. And I can assure you from my end, I'm a dentist. I completed my graduation in 2009 and my post-graduation in 2013, and I have spent 16 years in dentistry. And I have read around 15 to 20 books in dental cavities and so many literature reviews and so many articles around it. So let me assure you when I tell you that dental cavity is something which you can avoid. Only thing is you have to follow everything to the T. You have to understand how it's formed, and then we can actually reverse the whole cycle and we can avoid it. So an interesting fact about dental cavity is it is the second most common disease in the whole world, just after common flu. Yes, it's that common. And it is some disease which will, if we do not control at time, it can increase in its condition, and the tooth condition gets so bad that either you need a very massive filling on your tooth, or you might need some treatment which is called the root canal treatment, and then a cap over it. So the structure of this episode will be, I'll be telling you about the factors which cause dental cavities, and then within each factor we will understand that how that factor causes dental cavity and how we can reverse that process and stop dental cavity. Sounds easy? Let's get started. So basically there are 4 factors which cause dental cavities. Namely, the food, the microorganisms, the teeth itself, and time. Let's start with microorganisms. There are lakhs and lakhs of microorganisms present in an oral cavity. When a child is born, just within 4 hours of a child's birth, the oral cavity is inhabited by around 4 to 5 lakhs of bacteria. That is the state of oral cavity. So now the question comes that from where does the cavity causing bacteria come inside the mouth? Is it a normal inhabitant? Actually no, it is not something which is very normal. And if I don't have a dental cavity, it might be present, but it is not present in the quantity in which it can create cavities. Okay, so let's see how that happens, that how the bacteria gets into that size that it can cause cavities. How does it come inside the mouth at the first place? So how does the transfer of bacteria happen? Let's discuss that. The transfer of bacteria happens is if you have a small child, parents usually hug them, or they give them a peck on their cheek, or they share the spoons with which they are eating, they share a cookie, or they share a warm hug which is very close to their mouth. These are the places, anywhere if the cavity causing bacteria comes anywhere around this area, it can easily travel and get inside the mouth. These are the things which are very unavoidable. I am a mother and I know I can't stay away from my daughter, I have to hug her. So what these microorganisms do once they are inside your oral cavity? Once these microorganisms are inside your oral cavity, what happens is whenever you have some food, so we are human beings, we need food for survival. Whenever you eat something and there is a teeny tiny speck of it lying inside your mouth, and there is a presence of cavity causing bacteria, what it will do is it will go and nibble on that food. Whatever kind of food it is, if it can be broken down into carbohydrates and sugars, it is okay for bacteria. It will go, it will start nibbling on that food. In this process of nibbling, it will reciprocate, the colonies of the bacteria will increase, and in this whole process what happens is it forms acid. So when bacteria gets food, it grows and it forms acid as a byproduct. What happens with this acid? We all know that our teeth is made up of calcium. So when the acid goes in the calcium surface, the calcium gets etched. So this is the initiation of caries, what we call, or the initiation of dental decay. As in, when acid comes on contact with the tooth surface, what happens is a layer of calcium gets away from that. And in this whole process, what's happening is the colonies of bacteria are also growing. And when the surface of the tooth becomes a little rough, food lodgement will become a little more there. So all this happens in very microscopic, for the initial stage it's very micro level. So that is why it's very necessary that your mouth should not have any food left for the bacteria to go and eat. So this is the normal tooth. You can see the enamel, which is the uppermost strongest part of the whole body, is intact. Now here the cavity has started forming. It has invaded in the hardest substance of the tooth, and it happens when the tooth starts breaking down a little bit. Now it has gone beyond the enamel and it's gone into dentine. Here is when you find sensitivity, the food start lodging there, and you have to control it. And if we don't control, here is where the irreversible damage happens. It goes into the pulp. You experience all the pain, there might be swelling, and here we need root canal treatment. So, how can we prevent having microorganisms in the mouth? For the first place is avoid strangers to come in very contact with your child, or if you know that you have cavity, then at least try and stay a little at a distance from your child, or don't try and come directly towards the near the mouth or face. Don't share cutlery, okay, and just keep the oral cavity very clean so that the bacteria don't get food to eat. Okay. Coming to the next point, which is food. So let's start how food causes cavities. If you have seen my previous video, which was about five most common dental myths, in that I have discussed that sugars are considered the main culprit of dental cavities, but that is not the case. Cavity can be caused by any food which can be broken down into carbohydrate and sugars. It can be protein, it could be fat, it could be anything which can be broken down into simple sugars and carbohydrates. For bacteria, anything which is carbohydrate or sugar, it can be a speck of rice, it could be roti, it could be bread, it could be a crisp, it could be a piece of cake, brownie, anything. For bacteria, it's just food. Anything which can be broken down into simple sugars and carbohydrates, that can be assimilated into by the bacteria to reciprocate, and in the mean process form acid, which can etch our tooth. All right. So why we consider that sugars are main culprits, or sugars are more predilected towards causing cavities, is because sugary things are usually a little sticky in nature or gooey in nature. Suppose if we say for fudges or cakes or brownies, or for that matter custards, they are very gooey in consistency, so they have this tendency of going and sitting in the fissures. Whereas when you compare it to salads are very fibrous in nature, so whenever you try and chew them, usually there is a chance that you will find that a piece of cucumber or a piece of tomato is sitting on your tooth. Usually it's not the case, but even if a piece of tomato is there on your oral cavity stuck for a long time, till the time the bacteria can assimilate it, it can start forming cavity. What will it do is, with tomato, it will start forming its cavity, and whenever there's a single easy carbohydrate for it, there's a long load of bacteria which is available to already eat it. So we do not want any food inside the mouth. How can you prevent? How can food help in forming cavity? Now what can you do around it? Do not let food stay in your mouth. But what are the things which you can do for it? The simple things which you can do for it is, whenever you have anything other than water, it could be a glass of milk, tea, coffee, crisp, cookie, bread, whole meal, immediately once you're done, just take a sip of water. The best thing would be to do oral rinse. If you could gargle and swish your mouth and throw it out, that's the best. If at all you're at office setup or somewhere where you can't quickly go and swish, just use a little bit of drinking water, take 2-3 sips, swish in the mouth and drink it in. That can be done. It's a very handy tip. There's a little tip for the mothers of children. Being a mother, I have many such tips for you all coming. So if you have a small child, always look for the tooth map. It's something which is a hack which I used always for my daughter, and I've always recommended my patients, and they all have been benefited. Whenever your child has something which is not white in color, it could be a cookie, it could be a crisp or something, just open their mouth and check which are the areas of the tooth, the upper teeth and the lower teeth, where the food is getting lodged. You'll understand that those are the peculiar areas where food has a tendency of getting stuck. So you have to clean those areas, be it night, anything. If you clean those areas, cavity will not happen. If there's no food, cavity will not happen. Okay, so oral rinsing, keeping the oral cavity very clean, brushing twice is necessary. If you can brush only once, please do it at night. Twice brushing is mandatory with proper technique, using proper toothbrush and toothpaste for 2 minutes twice a day. Floss. When you floss, what happens is when all the teeth are joined to each other. So if the food is stuck in between, what floss does is it goes inside this area and it cleans it. So floss, clean your tongue. We might not understand, but our tongue has a lot of food residue into it. Whatever white slimy thing comes off when you clean your tongue is nothing but saliva mixed with food residues and bacteria. So clean your tongue, brush your teeth, clean your tongue, floss, swish your mouth whenever you eat something. These are the most minimal and simplistic things which you can do to keep your oral cavity free from food. Coming to the third factor, which is the teeth. Imagine it's a newborn baby, no teeth are there. There's a lot of food inside the mouth, so probably the bottle fed milk or the breast milk, it's inside the mouth. There are a lot of cavity causing bacteria also. Will there be any cavity? They can't, because there's no presence of teeth. So teeth is something, if there is a very young child, or if there's a geriatric patient or an old person who do not have teeth or who are having dentures, no cavity can happen in them. But we have to maintain the oral hygiene. For children, we need to be very cautious, because if there is more number of bacteria which is already there before the tooth erupts, what will happen is, whenever a single tooth starts to erupt on the child's oral cavity, all those bacteria will try and attack it. You must have heard by many parents saying that the tooth came like that. It was already cavitated. It was already brown. It was never brown. What happened was, the oral cavity is always so filled with microorganisms, which are cavity causing microorganisms, that as soon as the tooth started erupting, they started attacking it. And so the process of the tooth erupting and the process of cavity happened very simultaneously before the parents could actually catch a normal tooth. Okay, so no tooth, no cavity, but that doesn't mean that we do not take care of our oral hygiene. Coming to the fourth point, which is time. So again, giving you a setup where, suppose I have cavity causing bacteria in my mouth. I just ate a piece of cake and it's there all over my mouth, and I just slept with it. What will happen? I have teeth in my mouth, I have sugars in my mouth, I have lots of cavity causing bacteria in my mouth. And the most important factor is, because I did not clean them on time, the bacteria got time to assimilate all the food which is there, convert it into simple sugars, and then form acid and form cavity. So time is a very important factor. If we don't give bacteria this time, when it can break down the food into simple sugars, there will be no cavity. But at the same time, imagine the same scenario. I have had this cake, I have teeth, I have a lot of cavity causing bacteria, but I brush my teeth at night, there is no food particle on my mouth. Bacteria doesn't has anything which it can eat. And what will happen slowly, even if there are many number of bacteria in the mouth, and they start getting less food, their colonies will start depleting. That is how the caries process gets reversed also. So time is a very important factor again. We cannot give bacteria time for it to break down the food which is present into simple sugars and grow its colonies, and in turn produce acid which can etch our tooth. I hope it was not a lot of information for you all to assimilate, but so we had 4 factors just to revise. We had microorganisms, we had food, teeth, and time. Whenever all these 4 are together, cavity is sure to happen. Remove any one of this. There is no microorganisms, food may stay inside the mouth. There is teeth, there is time, but there are no cavity causing bacteria. Cavity cannot form. Remove food from mouth. There are a lot of cavity causing bacteria. There is teeth, there is time for those bacteria, but there is no food. They can't grow, cavity can't form. No teeth, no cavity. And if we have a lot of cavity causing bacteria, if we have food in mouth, if we have teeth in mouth, but we don't give them time and we clean them out very immediately, there will be no cavity. So the whole process I've explained you in simple terms, so that you understand that how cavity or dental decay happens. Once you understand this whole process of how a dental decay or a dental cavity happens, you know how to reverse all these things. Any one factor, you try to cut any one factor and there will be no dental cavity. No dental cavity, no dental fillings. No dental fillings or no neglected dental cavities, no root canal treatment, no caps, no crowns. Simple oral hygiene maintenance can save you so much, so much. It just costs a dime to keep proper oral hygiene. You need toothbrush, toothpaste, floss, you need water to swish, sometimes you need oral rinses, you need tongue scraper. These are the things which are very handy. We just have to be very dedicated and very consciously use them in the right technique at right time, so that we can prevent oral cavity or dental decay to happen inside our oral cavity. I hope you found this video useful, and if you find it, please like, share and subscribe to Edentofacia by Dr. Sonal Naidu. Edentofacia is a space where we'll talk about everything regarding your oral hygiene and oral health awareness. and there is a lot which is coming, and I will be linking in the description box below the previous videos which I have made. And please share with your friends and stay tuned, stay safe, lots of love.